In their battle against hospital-acquired infections, North Tees and Hartlepool NHS Foundation Trust are using a new System Sure Plus A.T.P monitoring system from Hygiena to assess the effectiveness of cleaning within the trust. The accuracy and cost-effectiveness of the system have also been recognised by NHS Scotland when it was selected as the preferred system to be introduced across the entire Scottish NHS at board level.
North Tees and Hartlepool hospitals have introduced the Hygiena System Sure Plus to help us combat the increase in healthcare-acquired infections. We are seeing a growth in antibiotic-resistant bacteria, and therefore we need to be able to validate our cleaning process to ensure that we can stop the spread of infections. Our cleaning scores have certainly improved since the introduction of the Hygiena System Sure Plus, and we've seen a corresponding decrease in the number of infections within our patients. So we feel that strongly that this is helping to combat the increase that we are seeing elsewhere within the health service.
The previous methods of cleaning inspections were visual inspection, where we would just actually go and look and see if a surface was clean. But now that we have System Sure Plus, we can actually swab equipment and swab surfaces and actually assess if it's clean or dirty by looking at the levels of potential microorganisms that are actually on that surface. So it's a much more accurate method of assessment.
We chose the Hygiena System Sure Plus over other products following the evaluation of a number of products on the market. We felt that the Hygiena system met our specific requirements and in fact provided us with the best value for money when we looked at it over a 3-year cycle.
A.T.P technology has received Level 1 status from the Rapid Review Panel and is included in the revised NHS Cleaning Manual. Sterile services also use A.T.P technology for cleaning verification, which has been found to be more effective than the recommended protein test under HTM 2030.
The Hygiena System Sure Plus is being used across the Trust by our quality monitoring officers, by our ward matrons and by our domestic supervisors, so that we can have instantaneous feedback on the standards of cleaning at ward level.
Each month we check all areas, especially clinical areas. We take out the swab and we do a surface test and we put that into the machine. It gives us a reading of if there's anything clean or dirty on that surface. We work on a numerical value of 100 and below is a pass, 200 and above is a fail, and we have anywhere in between, which is cautionary.
Infection Prevention and Control team recently sent the link workers out to their own ward areas to actually swab equipment such as drip stands, commodes, IV infusion pumps using System Sure Plus. And although the equipment on visual inspection actually looked clean, some of the scores for the equipment was actually a lot higher than they would have expected it to be. And it's actually just highlighted to staff that work on the wards that it really is important that they actually clean the equipment regularly and with appropriate products.
The benefits of using a System Sure Plus within a clinical area are that by swabbing the surfaces or objects within the ward area heightens staff awareness of the invisible harm that we could potentially do our patients. By also letting the staff actually participate in the use of illuminator, which is another term that we use for the device. This helps to think beyond the routine of the chore, if you like, of daily dressing and cleaning. The use of the System Sure Plus also gives trainees an immediate visual indication of how effective their cleaning process has been.
The Infection Prevention and Control team are using System Sure Plus primarily for mandatory hand hygiene training. We actually incorporate it into our teaching sessions and use it as a really useful tool to demonstrate if staff are actually complying with effective hand hygiene technique. So we'll actually ask them to volunteer and we'll swab areas of the hands that they may frequently miss or overlook when they're cleaning the hands. And sometimes they're quite shocked by the high scores.
The System Sure handheld collects all the information and then we need to download it onto the main computer, and then that gives us a monthly report of pie charts and graphs that are, and this report is issued to all the relevant people that require it. For example, nursing managers and matrons, so that we can all work together as a team to rectify any problems that occur.
We believe that the Hygiena System Shoer Plus has many applications. We're currently using it for our cleaning validation, but we're also looking to use it within our medical equipment library to assess the effectiveness of cleaning of medical equipment, but we'd also like to introduce it within our sterile services department and indeed our catering functions.